Hi everyone, Jess here with Alpine PT. This segment, I'm going to talk to you a little bit about returning to sport following COVID-19. Um, as we've seen, COVID is kind of increasing in prevalence in our community, and we just want to make sure coaches and parents have all the information they need to making safe choices with returning to athletics. Um, So it's important to know that COVID-19 is, kind of this new virus, and we are learning more all the time about it. So the information I'm going to share with you today is kind of where we're at right now, what we understand right now with how this can affect safety with exercise. And we know, and you probably have all seen in personal experience, just that it can really affect people in widely varying intensities. As mild as a mild cold to as severe as being in the hospital. So, but we still need to think that we have to make these choices because we don't fully understand, kind of the ramifications of having the COVID virus. So we know that COVID can affect the cardiac system, pulmonary, musculoskeletal, gastrointestinal, neurological, psychological, and renal systems, even in mild cases. And these following symptoms can linger even in elite athletes and otherwise healthy individuals. People can continue to have difficulty with breathing, extreme fatigue, irregular heart rhythms, myocarditis, which is inflammation of the heart, muscle aches, GI upset, and blood clots. Again, these things obviously would make exercise difficult. And currently, we think more mild cases have less of this, but again, like I said before, we are still learning, so we're just going to use that information to help us make decisions. So the information we're going to share with you today is from the American Pediatric Association, and they have put out these recommendations based on current knowledge. This information came out in the middle of December, just for reference. So in the first case, if you have an athlete with a positive COVID test, but no symptoms or very mild symptoms, so that would be less than 4 days of a fever or, kind of fever, chills, body aches, things like that. So the recommendation is to wait at least 10 days, and that would be of resting after the positive test and full resolution of symptoms. In this case, they also recommend that a physician provide clearance for return to exercise. And included in this clearance of the physician would be a cardiovascular screening. The next situation would be moderate symptoms. So this is where you'd have maybe greater than 4 days of fever, including aches, chills, or even a hospitalization. In this case, they recommend that you, again, wait 10 days of rest following the positive test, and additionally, 10 days of rest following full symptom resolution. So kind of whichever is the most conservative you would go with. And then after that waiting period, you would be cleared by your physician, but also they're recommending adding clearance by a cardiologist in this case. And again, this is primarily due to the risk of myocarditis. In the case of severe symptoms, this would be a stay in the ICU or intubation, or the multisystem inflammatory syndrome in children. It is recommended that you rest a full 3 to 6 months and get cardiologist clearance before returning to any training or competition. Obviously, in this case, you would probably be having a lot more interaction with the medical field and doctors, and probably getting a lot more information about when it's safe to return to different activities. So in general, everyone, really, we just want to remember that the lesson here is that, COVID, even in a mild case, is not really like the cold or the flu. And you really have to give your body some time to work through these symptoms and make sure that nothing severe is going on underneath the surface. So the APA is recommending that even once you've been cleared, that you take time to work back up to normal exertional levels. They recommend kind of a 7-day course of gradual increasing exertion before you're kind of even back to 100% competition. And Importantly, if you have any of the following symptoms, chest pain, fatigue, difficulty breathing, palpitations, or fever, that you cease exercise and you return to your physician for a further workup. And again, this kind of gradual, slow recommendation is really based on the fact that COVID can affect how our lungs are able to exchange oxygen, which our body and muscles needs for exercise, and also this possibility of how it can affect the heart muscle. And again, sometimes these symptoms really are kind of go unseen until you begin to stress your system with more exercise. So just good information to be aware of and help us all make better choices. And in the meantime, everybody stay safe and healthy.